Hi, my name is Philip Gibson. I am the North Carolina Radon Program Coordinator for the North Carolina Department of Health and Human Services. I'd like to take a moment and share with you just a quick snippet of information about radon and how to prevent lung cancer from this naturally occurring gas. So radon-induced lung cancer is the leading cause of lung cancer among non-smokers in the United States. So let me say that in a different way. If you're a never smoker, radon is the leading cause of lung cancer, second only to tobacco smoking. If you are a person who has ever smoked tobacco in your life, then you in fact are at a greater risk from radon-induced lung cancer. And we estimate that roughly 21,000 people die of radon-induced lung cancer each year. Now, radon can't be seen, tasted, or smelled, but there is a way to see it, and it's through this device called a cloud chamber. Now, what they've done is placed a piece of uranium in the center of that glass. They've rubbed some rubbing alcohol onto the glass. They're enclosing it, and they're going to put some more rubbing alcohol on the felt around the lid. Now, when they turn the machine on, it's going to produce a light, but it's also going to create cooling or refrigeration inside that unit. Now, uranium is found naturally all over the world in rock and soil. So it's a naturally occurring element. And when it decays, it releases radioactive particles that we call radon gas. Now, this machine allows us to see that decay process. So as they turn it on, they're going to turn off the overhead light. They've obviously illuminated inside the box, and they're cooling it off inside. And between the vapors from the alcohol and the cooling, and then the release of these radioactive particles, we are going to be able to see radon inside this unit. Now, the reason I share this with you is that I want you to know that this is happening around us all the time, even outdoors. So the question is not, are you exposed to radon gas, but how much are you exposed to? What's the risk? What's the concentration inside your home or other buildings? So this is happening, release of radioactive particles, and then these particles are being drawn into our home. Now, this representation shows you, or this diagram shows you, rather this illustration, this picture shows you different pathways of how radon enters our homes. So cracks and crevices, joints where the walls and the floors come together. If you're on well water, it also could come in through your shower, so forth. When you do the dishwasher, the washing machine, these gases could be released inside of your home. So that's why we're asking everyone to consider testing your home for radon. Science has shown us that 1 in 15 homes in the United States has a level of 4 picocuries per liter or more. So people want to ask, well, I live in this neighborhood, or I live in this county, or I live in this part of the state. Do I have a chance for elevated radon? And the answer is you won't know until you test. We just know that 1 in 15 homes has an elevated radon level. The only 2 home types that may not have an elevated radon are tree houses and houseboats. But we know there are high levels that have been measured in counties throughout North Carolina. 77 of the 100 counties in North Carolina have had elevated radon levels. So in Wake County, you can see that 257.8 was the highest that was measured in that county. And then you can see the counties around what their levels were. We give away free radon test kits each year. This is our future web address. I'd like for you to go to ncradon.org. That's ncradon.org, and you can order a test kit. Now, there's a limited number of test kits for now, but we'll be giving them away again in January of 2023. There is not an acceptable level of radon. There's not a public health standard. It's basically, if you have a level of 4 picocuries per liter or more tested in your home, we strongly recommend that you hire a professional to come and lower the level into your from your home or in your home. So how do you lower the level? Well, again, hiring a certified professional. You can find one on our website. And then what they would do is come and give you an estimate. And the estimate most likely will be around $1,500. And what they're going to do is have a suction system, a point where they're going to draw gases from underneath your home and then discharge them above the eave of your roof. There's a lot of information on our website, videos and so forth. Go to ncradon.org. You'll be able to see those things, order a free test kit, and contact me if you have additional questions. Thanks so much for this opportunity. I hope this has been of help to you. Look forward to hearing from you. Thanks.